Rounding up new supplies while trying to get back into the routine. The start of the new school year can be pretty stressful, and now sprinkle in a little ongoing pandemic and another surge and another virus. And this fall brings a lot of added concerns.
A lot of it. And tonight, News 5 anchor Mike Brookbank takes a look at the latest spike in monkeypox cases across the country and the impact it's having on parents getting ready to send their children back to class.
This week, questions about monkeypox
Parents are worried about their kids getting monkeypox.
prompted pediatrician Shelley Senders to send out a newsletter with talking points about the virus.
Because the volume had really gone up significantly.
Right now, he says there are only 4 monkeypox cases in children in the United States.
So 4 out of 330 million is actually a very small number.
And Dr. Senders believes that number is going to remain low, with the rare disease unlikely to impact children.
Almost always have to have contact with someone and close, intimate contact in order for you to get it.
That's primarily why I'm not terribly worried about my kids.
Ryan Zeltner Keegan's son, James, is headed to 4th grade.
A little overwhelming trying to decide what to do for the fall.
Her daughter, Josephine, is headed to 1st.
They just had their second boosters, so I think we're ready to go.
Zeltner Keegan tells me her main health concern when it comes to her children
Okay, last time, then you gotta scrub.
remains COVID-19.
Okay, really scrub, okay?
As she's seen fewer basic COVID protocols
I do think people aren't wearing their masks as much.
being practiced out in public.
I'm concerned we're gonna have a lot of outbreaks of everything in the fall.
So if Dr. Senders is telling parents they don't have to worry about monkeypox, is there something else that they should have on their radar?
It's really the usual things. You know, in some ways, we're really getting back to 2019.
Senders tells me we should expect the return of those run-of-the-mill illnesses.
The things that kids are getting are just garden variety viruses, colds, runny noses, and things like that.
When it comes to COVID, these latest variants may be more transmissible, but Senders says they're no more severe.
And I see a time in the not so far distance where the standard will be that you don't need to be isolated or quarantined for long periods of time.
Reporting in South Euclid, Mike Brookbank, News 5.
And we go in depth now with a look at the origins of monkeypox. It was discovered in 1958 when 2 outbreaks of a pox-like disease occurred in monkeys that were kept for research. Now, despite being named monkeypox, the exact source of the disease remains unknown. The first human case of monkeypox was recorded in 1970. Before this year's outbreak, monkeypox had been reported in people in several Central and Western African countries. Now, monkeypox comes from the same family of viruses that causes smallpox. However, it is not related to chickenpox.